It is all about information and fighting fear with facts. It's what we're attempting to do every weeknight during this pandemic around the same time. Tonight, we are joined by Mayor Ron Nirenberg. Mayor, thank you for joining us again here on a Wednesday. And you have expressed some concern about the fact that a lot of people aren't being tested. And that's really the first question we have tonight. Why do you think more people aren't being tested?
You know, it's a head scratcher because we've been working on expanding testing for some time, and we've had plenty of capacity to test everyone who comes to seek one, and we just haven't seen that many people come and get tests. We've had roughly 1,600. I think we have over 2,000 tests available to us per day, and we haven't seen those numbers. There's a couple things going on to assess that, and the reasons why. One is that we are moving those testing facilities around the city, targeting areas where we know there's less healthcare access and where we've seen fewer people seek the test. We're also trying to get information out there. There's, some information and some concern from people that, might be painful to get the test. We're saying it's very simple. You're seen by someone who knows what they're doing, and they can make it very quick, and you can get your test results very quickly. The other thing is, correcting the information that's out there. The testing protocols have changed a number of times over the course of the pandemic from the CDC and at the local level. Currently, you don't need a doctor, you don't need an appointment, you don't need money, and you don't need symptoms to get a test. If you need to get a test, obviously we'd like for there to be a reason, like you've been exposed to someone who has it, or you do have symptoms. But if you want a test, you can get a test, and we have a number of different sites on the website. You can go and look where they're taking tests, sanantonio.gov/COVID-19.
Yeah, right now there are enough tests for everybody. It's just that there aren't as many people as anticipated getting tested.
That's right, and we want to get up to roughly 3,000 a day over the next few weeks.
Next question is there an effort being made to encourage more recovered patients to donate plasma?
There are, and our mental health team provides information. The providers provide information as well about plasma donation upon recovery. Obviously, not everyone wants to do that, but the people who show interest, they're followed up with. And unfortunately, there hasn't been a large number of people who have donated plasma, but for those who have, they are saving lives. We've talked about a good friend, Paul Balzadua, whose story we shared quite a bit about his donation of plasma, provided for enough to provide for the recoveries of 5 people. And so we encourage it. It's easy. It's something that can save many, many lives, and it's very effective. So if you have interest, if you've recovered from COVID-19, we want to put that information in your hands so you could potentially be a donor of plasma that could save many lives in our community.
Yeah, that's great what you just said. I want to make, because we've gotten that question before, how much can one recovered plasma donation, how many lives or how many patients could it possibly save? And you said that 5, so that's...
The donation that Paul gave in his story and the picture that you saw, he was holding the plasma donation from one event, and it was enough for 5 patients.
Yeah, that's great. I know a lot has been made about masks and face coverings. Have you ever considered mandating gloves be worn?
We haven't, and obviously in certain situations gloves are warranted, but the most effective way of protecting yourself other than wearing a mask is to do what you should be doing anyways, which is washing your hands with soap and water. Gloves potentially can give you a false sense of security. If we get different guidance about gloves from the CDC, then we will offer that here at the local level. But right now, the mask prevents someone who has the droplets that could contain the virus from going to someone else, whether or not they are symptomatic or not. And we want to continue the very basic soap and water, washing of hands, 20 seconds, which is enough time to sing happy birthday twice.
Yeah. In the wake of AG Ken Paxton's letter yesterday, are you going to make any changes to the emergency ordinances that the city has set forward?
No. In fact, Andy Segovia, a brilliant attorney, our city attorney, was on the show, was on the briefing last night to explain how the Deputy Attorney General who wrote the letter to us clearly didn't have the facts about our orders, because everything that was in our orders addressed the issues in his letter. We wrote it purposefully inclusive of the governor's language to make sure it did not conflict. And so we're going to continue to go with that. Obviously, the attention is on masks. The governor was very clear. We do not have the authority to issue fines, and we haven't issued a fine. But it is important that people know that masks ought to be worn because it clearly prevents the spread of the disease, especially among those who are carrying it asymptomatically. It's guidance from the CDC, it's guidance from our local public health professionals, and it's even in the language that the governor orders himself. So clearly there's a disconnect between Ken Paxton's office and what the medical professionals unanimously have said about preventing the spread of this disease.
All right, I want to get to some more viewer questions now. Somebody wants to know, can they report someone to 311 for not social distancing?
Yeah, I mean, you can. Social distancing is not is part of the protocols that we should all be comfortable with and understand in order to prevent the spread of the disease. But there's only some particular circumstances within businesses that there are mandatory requirements. What they are in general, though, is that you need to be following these guidelines. Stay 6 feet away from people who do not reside in your household. Otherwise, if you're in a situation where you know you can't maintain that, wear a mask. It's pretty simple stuff. We're just trying to save lives, keep people healthy, and that will allow us to open up our economy and enjoy the things that we're used to doing.
All right, last question before I give you the floor here to talk about what you want to talk about. But how much money does San Antonio anticipate on spending on testing?
Our health transition team had some great recommendations that are now guiding the next actions through our Metro Health Department, as well as the City Council and the city organization in general. And our health plan calls for roughly $70 million, which are reimbursable from the federal government for standing up testing, tracing, and isolation protocols for our city. The first and most important thing that we can do to get our economy back on track is to make sure that we have the capacity to identify new infections of this virus when it's out in the community, to trace where they're coming from, and ultimately to locate and isolate them. We know that it is impossible for us to expect that there will be zero occurrences of this virus in our community. But what we can do is make sure that we can contain what's out there and identify what comes as quickly as possible so we can isolate it, and the rest of the community and the rest of the rest of the life in the city can go on as we maintain our containment.
Right. All right. I want to give you the floor now. What do you want our viewers to know tonight?
This community has saved, according to the health studies, roughly 8,000 lives, more than 8,000 lives in the last 6 weeks of observance of physical distancing guidelines, the stay-at-home orders, the prevention measures that we put in place that were guided by our health professionals. That's 8,000 people who may have been a family member, a loved one, a friend, a neighbor. That has been done by our community because we have stood in solidarity with one another. It's not because there have been mandates. It's not because there have been the threat of fines. It is simply because we care for one another. This is a compassionate community. None of that changes as new orders come in, as there's potential mixed messages from the state and the federal government. We care about one another. This is a compassionate community, so let's continue to get the job done on behalf of one another to save one another's lives, and let's continue to build a city that we can be proud of and leave to our next generation, our children and our grandchildren.
What we're all doing is making a difference. Mr. Mayor, I appreciate your time.
No doubt.
Yeah.
Thanks so much, Steve. Have a great evening.
You too. We'll be right back.